Hello everyone, today we're going to be talking about our anterior cervical spinal disc replacement. My name is Elie Karam.
I'm Charles Hill.
And I'm Nick Dalton.
So after the age of 40, about 60% of the population experience some kind of degenerative disc disease. This leads to 187,000 anterior cervical procedures conducted every year. The gold standard procedure for this kind of surgery is the anterior cervical disc fusion, or ACDF, which consists of removing the affected discs and replacing it with some kind of bone graft or cage, and then using a metal plate to stabilize it. However, this does come with some issues, such that 25% of these patients end up experiencing resurgery within 10 years due to the deformation of the spinal segments or adjacent segment disease, or ASD. The alternative to this procedure is cervical total disc replacement. And what it does is it aims to maintain segmental motion and reduces the risk of ASD. But however, it comes with its own issues, such that wear debris from the fretting can cause damage to the surrounding tissue, which can lead to dislodging of prosthesis and inflammation due to macrophage response.
So our approach is going to mitigate the wear resistance, improve osseointegration, increase the range of motion, and decrease the surgical time. So our design is 2 plates that have 2 anchor points on each side, as well as a center that's composed of a hydrogel with 4 self-reinforced 90 springs. So the plates are made out of calcium phosphate coated magnesium alloy called AZ31, and the elastic modulus of this plate is going to be more similar to bone, which is going to mitigate the stress shielding and increase healthy bone growth. Also, the plates are able to degrade within the body with no cytotoxic effects, as well as replace it with healthy bone growth. For instance, 81% of bone replacement occurs in 6 months with replacing degraded metals. Now the springs are made out of porous nitinol, and with those actors, those are anchorage points. When the plates dissolve, the edges of the springs are going to anchor into the bone, since it has a porous structure to allow bony ingrowth. And then the high compressive strength, as well as the super elastic recovery, is going to allow it to maintain that disc structure needed for the ideal range of motion. Now the hydrogel in the center is a gum, or a gelatin gum bioactive glass composite hydrogel, and it also has an extremely high compressive strength that will be helpful for daily use in the body, as well as bioconductive and hydrophilic, which allows the bone cells to grow right up to the surface and create a more natural state.
So moving into the benefits of our device. So first off, it will prevent the overload or degeneration of adjacent discs, which is common within the fusion surgery earlier stated. Secondly, it will be able to better transmit axial loads between intervertebral segments using our novel spring system. This will help maintain a normal range of motion for the patient. Additionally, it will prevent dislodging of the prosthesis by allowing better bony integration with our titanium end plate and coating system. And lastly, as a quick wrap up, the average disc replacement surgery is about 10% cheaper initially and 30% cheaper over a 4-year period when compared to the fusion surgery.
And the costs associated with this device are mostly going to come from the fact that it's a combination of many materials, as well as the Class 3 device. This is going to take a lot of approval testing from the FDA. It's going to take a lot of time for it to make it to the market, which is going to increase the amount of cost put into this product. Also, the alloys used are highly specialized and very expensive. For instance, nitinol itself is about 400% more expensive than steel.
So moving on to our competition, currently there are 3 FDA-approved devices on the market. The first of which is ProDisc C. Some issues that have been expressed with this are dysphagia, which are issues swallowing or passing of food because the implant tends to press up against the esophagus in the patient. Also heterotropic ossification, which is bony growth outside the skeletal system into soft tissues, causing patient discomfort. Then the second implant has a poor operative approach and lends itself to migrate or loosening within the system of the patient. And thirdly is the Prestige implant, which has issues with metal corrosion as it frets and wears, causing debris buildup within the patient. So if our device is not instituted, these issues will persist and cause secondary surgeries to continue for the patient.
We hope to appeal to surgeons conducting spinal surgery so that they turn away from ACDF and use more spinal disc replacement as a procedure for spinal surgery so they can further benefit the future health of patients who need spine surgery. Thank you very much.